If you are a new grad, right? Not even a new grad. If you're a student in occupational therapy school and you're about to do your internship, Carla is here. She's doing her internship, so we thought we'd do a video like this. She's got a zillion questions, but they're all over the place. So we're gonna work through this together, okay? My name is Juan with Hand Therapy Secrets, and I just want to help you be more prepared when you go to your field work, right? Especially if you go into one doing hand therapy. And how scared were you coming in here? Do I have a bad reputation? You can tell me. You can tell me. You can tell me if I have a bad reputation. I'm kind of hard, and I don't mind being difficult.
Excellent reputation, but it's the good way, hard learning type of.
I know it is hard learning. So I think a lot of people do get intimidated because it's hand therapy, right? So everyone's shaking in their boots, being told in school like, oh my God, hand therapy is so hard. It's really not that freaking hard, okay? It really isn't, I swear. I just kind of make it hard because I think it's funny, but no, I'm kidding. So it's really not that hard. And the biggest thing is not telling yourself stories. That's hard. That's the biggest thing. When you asked me, one of your questions was like, dear Lord, what kind of mindset should you have coming in with and throughout this experience, right? So the biggest thing is, don't think it's hard. Think it's fun. If you think it's hard, you'll make it hard for you. If you think it's hard, you'll get even more nervous. And the most important thing when it comes to hand therapy, yes, it is a specialty within occupational therapy, but when you're coming in as a student, you're not expected to know everything, right? You're not expected to know everything. And I think a lot of times people get nervous because they think that they're expected to know something. And I would say you're expected to know the basics. So I've taught at the university level, and you are expected to have some amount of knowledge as it pertains to using a goniometer, right? I don't care what shape, what size, it's the same thing. So you should know how to use a goniometer. And if you don't, you should practice a little bit before you start. It doesn't have to be perfect. It doesn't have to be the way your CI does it. You just have to have a certain understanding of it, right? So I usually say a goniometer is key. Be familiar with some very simple things that I know you've practiced at the university level, which is a dynamometer, the pinch gauge, right? And sensibility testing, right? Super easy. It's really the basic. And then your CI will teach you and say, this is how I like to have it done, because I do that. This is how I like to have it done. I use a half moon goniometer or a finger pocket goniometer, whatever it's called. It's just a different shape, but it measures the same way. Measures the same way, fingers, wrists, supination, pronation. But those are things that I think beginning you should know. But the mindset is to come in and say, I'm here to learn, right? Nobody likes someone coming in and being lazy and not wanting to learn, right? So if you're going to be in a specialty place, you should know that setting a little bit. You should know, okay, I'm going into this place, let me research it. You know, if you're coming to hands-on therapy services, you know, we have a social media presence. You should be able to see that. You should look it up. You should look at the website. It's just like any place. You go to a training place, you kind of know what you're getting to because you can look them up. You know, because they're trained, they're all over the place. You're bound to talk to somebody, right? So you essentially know that place a little bit. If you go into a hospital place setting, you kind of know that too. So you're doing a little bit of research, which everyone should be doing. If you're applying for a job, you should be researching the place that you're applying for a job. And nothing irritates me more than people who apply for my job and don't know shit about my company. Like, it's true though. I mean, you're trying to get a job. What if you don't really want it? You know, you should, right. So I think that if you have that kind of mindset that you want to learn, I think it's going to help you. How do you get comfortable with a goniometer? You practice. That's all. I mean, I wish it was much harder. But you're literally practicing. You get a goniometer and you practice on people, real live people with no problems, and you pretend they have problems, you know, and then you measure, right? So that is the biggest thing. So when it comes to, what tips do you have to learn the hand anatomy? Well, you know, a great thing about learning anatomy is that you have 2 hands. So I have this finger, I have this bone, and this bone. So you have your book. You have in school, I mean, you have your manual muscle testing book, right? Don't you have a manual, girl?
I have my...
Don't you know how to do manual muscle testing?
Yes. That, yes.
She's just saying yes, but she don't know because it's not my favorite thing to do. So she probably hasn't been quizzed and tested on it, but you can do general anatomy. Like, honestly, people are like, oh my God, how much anatomy? You know the brachial plexus? You kind of don't.
Yeah.
I'm going to say everything that other people say to do. I'm going to say the opposite. You don't need to know unless you go into a place where they just do tons of brachial plexus, right? But you know your place if you go and you're doing an internship at a heavily orthopedic based place inside of a surgeon's office. Well, guess what? You're getting a lot of fingers, you're getting a lot of wrists, so you should know the basics. You don't need to know it at the level as a certified hand therapist would know. They're there to teach you, but you do need to know your basics. Okay, this is this bone. Let's see what kind of some general common injuries that I know you studied in OT school too, right? Distal radius. You can have a distal radius from a baby, like from a little kid to a medium-sized kid to an adult to an older adult to a geriatric. So it's like such a common injury, right? So I would think that, again, the basics really help. For new students, what are some tips that I have to deal with nervousness? What do I recommend for you to be confident? Stop telling yourself stories that you're not. Stop telling yourself, you know, if you had a friend and that friend talks shit to you every day, would you say listening? No. So everything is here. Like, you stop being so mean to yourself. Stop being so mean to yourself. So confidence comes from, you know, knowing that you have the ability, right? Just knowing that you have the ability. True confidence comes from seeing the success. So sometimes you're not going to get that full sense of 100% confidence because you haven't maybe been successful yet. See that word, yet? So you do one internship and you're like, so your confidence should be like, well, dang, I got into OT school and I passed a couple of my classes. That alone should give you a certain amount of confidence, right? You've got to take that confidence and you've got to tell yourself you know stuff and it's possible for you to be successful. You have to take that. So it starts kind of like with a lot of self-talk and you know, that friend of yours that's not saying nice things, like maybe not hang out with that person so much, right? Which means that's in your head, like stop them from talking shit about you. Listen to the person that says good things about you, right? So that's how you get some of that confidence. And then once you're in the setting, you know, as you do things, you have to find your success. You have to find the things that you're doing well with. It's very, very easy for us, like human nature wise, to find the things that we're not doing so good, right? So we're like, oh my God, I didn't do that one so well. But what did you do really well that day? You know, what did you do really well in that hour, that moment with that person, you know, that you did really well. So maybe it wasn't 100% perfect, but you're able to survive. And the most successful thing that you can give yourself is that, did I learn something from that? And if you learn something from that will make you better the next hour with the next patient, then you should count yourself as being successful, right? So we talked through some cases today, And we talked through some cases where you didn't feel so successful because the patient, just didn't listen to you, didn't follow directions very well, or still was in a lot of pain. But you could count yourself as being successful as if you were able to be brave enough to ask the question that you asked, which is, what can I do to think through this case better, to pick better activities? I would say that was very successful, right? And so you have to find those moments where you are successful, and then it's those little moments that you build and build and build that will over time give you the confidence that you need to work more independently and alone. And the most important thing when it comes to internships is you're there to learn, right? You're not there to know everything. But the most important thing that you could do for yourself in an internship is to learn as much as possible, because whatever you learn in this internship, you'll take and do to the next internship, at the next internship. And when you're done with your internships and you pass your boards, you're gonna take those experiences and then you can say, I'm applying for these jobs because I know what I'm doing, right? If I know how to evaluate in this case, in this setting, I know how to evaluate in the next setting. The only things that change are a few types of questions, right? The change that you do in documentation is what you're documenting, but it's the same strategy. So if you learn how to evaluate in a hand therapy setting, and you go to acute care, or you're from acute care and you go into a hand therapy setting, you're still doing this evaluation is an evaluation, which is to find out what happened, and then figure out what you can do to help this person, right? Find out what happened, and then you figure out how you're going to help this person, achieve whatever the goal, and you create a plan. That's an evaluation in a nutshell. And then you have to document that, and then the carrying out part is a little different. You need some skills? I've got the hand therapy mentorship program, right? So yeah, we've got that to develop your skills, but yeah, that's really darn it, I distracted myself. That's pretty much what you need from one setting to the next setting to the next setting, so that when you come out, you can say, I know how to do this job, please give me a job. I'd be great at this job. I have X skill this, X skill that. Now you have skills treating a flexor tendon. You did some wound care. You have 2 weeks to master splinting. No, I'm kidding. You have to practice your casting, so you can go out there and say, oh, I did a little bit of this X, Y, and Z. All right. So those are some key aspects when it comes to your internships. I hope this video has helped you. I know it's a little bit long. There's some joking around in there, but I hope this helps you. My name is Huang with Hand Therapy Secrets. If you like videos like this, consider subscribing, and of course, get on my email list with the links below, based on if you need to get the guide for how to get a job, or if you've got the job and you need some help with your skills, then there's a hand therapy mentorship program. And if you've got your hours and you've got your years and you're trying to become a certified hand therapist and need a little bit of help, I've got a program for you too. So click the links below and get the information that you need. Okay, I'll talk to you guys soon.